Today we'll be reviewing a case study by Dr. Robert Garowitz, who treated a 9-year-old boy named Peter with Euclid Emerald lenses for overnight Orthokeratology. With the use of emerald lenses, we were able to correct and stabilize Peter's vision. Peter's baseline parameters are a good example of an ideal Ortho-K patient. First, he is a young patient at 9 years old, which is the best case to fit. Young eyes adjust to Ortho-K treatment very quickly. His refraction is below the FDA limit of -5 diopters myopia and less than 1.5 diopters astigmatism. We recommend that practitioners fit patients with astigmatism that is no more than half of their spherical refraction. Peter's keratometry readings are also ideal. He shows minimal corneal astigmatism, and his readings are neither abnormally flat nor steep. We recommend that practitioners fit patients with K readings between 40 and 45. Euclid Emerald lenses can be made for patients with parameters that are outside of these ideal ranges. However, these lenses are approved on a case-by-case basis after discussion with our consultation staff. Peter's pre-treatment topography maps show a typical corneal distribution. Mild astigmatism is noted, slightly stronger on the right than the left, which corresponds with his refraction. However, both eyes' astigmatism is central, and the eyes are otherwise mostly spherical with no noted ocular diseases or abnormalities. These topography maps will be crucial for comparison with all follow-up topographies after treatment begins. Euclid Emerald lenses are made to order for each patient. Here you can see the primary parameters of Peter's lenses. After time for the lenses to settle, Peter's vision with the lenses on was improved from baseline at 20/20 for both eyes. A fluorescein examination showed a good fit for the lenses with the Ortho-K bullseye pattern showing the reverse geometry. Dr. Garowitz scheduled a follow-up for 1 week. Here we see Peter at his first insertion after about 10 minutes of wear. Dr. Garowitz directs Peter's blink patterns to assess the fit under fluorescein. We can see very good lens position and good 360-degree alignment. This fitting gives us a good idea of the lens position during wear tonight. After 90 minutes of wear on Peter's first insertion, Dr. Garowitz has instilled more fluorescein to better see the fit. The lens fit is excellent, with good centration and 360-degree alignment. After 90 minutes of wear, Peter is seeing 20/20 in each eye and binocularly. On the left, there is a small insertion bubble, which is not a problem. The doctor is satisfied with the alignment fit visible during blinking, and there's a nice, well-centered treatment zone. Dr. Garowitz predicts good follow-up appointment results.
This is Peter, and it's his day 1 visit. How did last night go, Peter?
Good.
Yeah? Did the molds go in pretty easy?
It did go pretty easy.
Good. How did they feel when you were sleeping?
I felt nothing.
Excellent. All right, so we're going to check your vision next, okay? Okay. This is my assistant, Barry. She's putting sodium fluorescein in Peter's eyes. Prior to checking acuities, it's been my experience that patients see a little bit better if we pre-wet the eye, and since we're going to use sodium fluorescein anyways, we're going to use it to pre-wet the eye prior to acuities. Yeah.
Go ahead and cover your left eye.
Okay.
And read the smallest line you can see.
Can't read that.
Read this one.
Can't read that. E-F F T-A-N-E.
Okay. Let's try your other eye. Can you read the same one?
P-T-A-N-E.
Okay, try this one.
Still can't read it. F-R-H-O-Z.
Okay. Let's try both eyes. Can you read this one?
A-T-P-E-R-N.
Let's try one more.
G-Z-F-E-R.
Okay.
Okay, so today Peter was 20/50 on the right eye, 20/40 on the left eye, and 20/30 plus with both eyes one night, Ortho-K. Peter is in the 200 to 300 diopter range, so this is a nice day 1 outcome.
At the first follow-up visit, the treatment topographies can be compared to the baseline topos we took previously. At this point, although the bullseye pattern can be seen, it is very faint. This corresponds to his visual acuities, which were higher in the left eye than the right. It could be said that Peter was not getting enough push, or molding, on his cornea right now. You might ask if it would be appropriate to adjust the fit or target power on his lens at this point in order to get more correction. The answer is a definitive no. Unless there are signs of a poor fit or medical issues, lenses should not be changed after 1 day of wear. Patients must wear their lenses for at least a week before evaluating any possible changes, and they may take up to 4 weeks to fully stabilize. In comparison to the right eye, which has minimal correction, the left eye is a textbook example of the desired Ortho-K fit. The bullseye ring is well centered and very strong, even after 1 day. Peter will continue to wear the lenses and follow up again in 1 week.
This is Peter, and we're doing his 1-week Ortho-K visit. Peter, how's your vision?
Good.
Good. Is it getting easier to put in the molds and take them out?
It is.
Excellent. All right, we're going to check your vision now.
Okay.
Okay, so Peter, we're going to check your right eye first.
Read the smallest sign you can see.
N-O-A-R-Z.
Well, that was too easy. Let's go smaller, Barry, okay?
Okay.
Good.
Can see a Z in there, a N, and I can't read the rest three.
All right, so that was 20/20 plus 1. Let's do the other eye, Peter. Open real big now. Good.
T-P-H-F-D.
Good. Let's go 1 line smaller.
E-D-A-Z-R.
Good, so that's 2015 minus 2. Let's drop the paddle, and let's do that same line backwards, please.
R-Z-A-O-E.
That's perfect. That was 2015 vision after 1 week.
After 1 week of wear, Peter's slit lamp exam looks wonderful. Dr. Garowitz has instilled fluorescein to evaluate Peter's corneal health. The cornea looks very clear with no staining in either eye. The doctor switches the light, and although Peter has some difficulty keeping his eyes open, you can still see that this view also shows great corneas. With a healthy follow-up and clear corneas, Peter can continue wear and the regular follow-up schedule. After 1 week, Peter's right eye is improving. The ring is becoming more clear and is staying very well centered. This follows with Peter's visual acuities, which were 20/20 plus 1 for the right eye. It should be apparent that the initial empirically fit lens did not need any adjustments, but only more time. We will continue to follow up with his vision at future follow-up appointments. As the right eye improved over a week, so did the left. The strong ring is even stronger and still centered. After 6 weeks, Peter's vision continues to be excellent. He is seeing better than 20/20 with binocular vision. The right eye's topography is now very strong. There are no traces of his baseline central astigmatism. His left eye also remains very satisfying. The bullseye pattern is clear and crisp. After 3 months, Peter's vision has continued to improve from the 6-week appointment, so that he is now seeing 20/15 in each eye. After 3 months, Peter is now removing his own lenses and gaining independence with them. After 3 months, his right eye topography is almost a mirror image of his left, despite not appearing to have a good effect at the 1-day follow-up. The left eye is doing very well and remaining essentially unchanged. At this point, Peter can continue with regular follow-up visits and care. His vision is excellent, he is managing his own contact lenses, and his eyes are healthy, with the help of Euclid Emerald lenses.